office, your doctor, and he look at you, he didn't say a word. All he does is just look at your medical report, especially your lab report, and suddenly he tells you something that you might want to hear. For instance, he say you have to go for a dialysis from next week onward. You have got no choice. Here is the reason why, or let me tell you all this reason, and then you have to decide today. Yes or no, you still have to go. My question is, how would you feel when a doctor says so to you and he just leave it for your decision to make? I want to help you tonight to make sure that before you even listen to that kind of voice or that kind of sentence, you have to go for a dialysis from next week onward. Question is, how would you feel now when a doctor said so in front of you? Please let me know. Just write down there a little of your feeling, whether you're sad or you panic or you feel like fainting. It's not uncommon to hear all this kind of response. All right, no, yeah, okay. By any chance, you know anyone, if you are not having yet any kidney problem, oh, by the way, you wouldn't know your kidney, whether it's functioning well or not, until and unless you do a few things. So are you ready to learn? So that despite the kidney not telling you a lot of things, sometimes by the time it shows up like what? Sometimes it's too late, like already your eyes are puffy, your leg is already swollen up, but you got pitting edema, you know about that? Why don't you press your skin above your ankle now and have a look just press it for about 10 seconds. Then you lift it up. Have a look. Is there any pitting edema there? Is your skin been just having a hollow there for a few seconds before it comes back? Or the whole feet, both of it is already quite swollen up. Now, normally, if you haven't been standing for too long the whole of today and suddenly you still have it now, then you may want to listen a bit more. And some of you may have nocturia. Nocturia means you will wake up. Usually you did not wake up in the middle of the night and you have to pass urine like say 2 or 3 times. Or some people say if a man may have prostate, yes, you have excluded prostate. So what else left? Usually you have to check your kidney, right? And look at your fingernail now. How many of you can see there's a whitish reverse, what they call moon? Okay, half moon, okay, or quarter moon. The moon down there, reverse, upside down, and you see it's whitish. That's normal. And most of those of you are too late having kidney problem is already gone. You can't see much there. Usually all, at least 1/3 of your fingernail, especially the thumb, is completely white. Or sometimes you see a bit darkened or reddish on top of your fingernails. These are some of the signs that it's already too late. But before that happen, sometimes you might already have what they call cramps. Your muscles start to cramp and you have restless leg. Your leg became unsettled. You can't sleep at night, and even your smell, your breath is like urine. And you taste something like a metallic taste, like you are lurking on what do you call these shillings. You know, if you put shillings in the mouth, you feel it's metallic. That's how urea producing ammonia. Therefore, the smell and the taste, you have no appetite. You know, and some of you may have even loss of height. Your height becomes slightly shorter by maybe a couple of 1 or 2 centimeter. You might not realize it, right? This is also some of the effect of calcium metabolism that's disturbed during your kidney, what you call, getting worse and worse. And of course, once you have vomiting and nausea, very fatigued all the time, and you easily bruised. Bruising is one of the signs that is becoming too late. okay? And most of all, what is important about tonight's lecture or knowledge is for you to know that 90% of you will not have any of these symptoms. Usually it's too late when a doctor said you have to go for dialysis. Why? Because you did not check when you are 60, 50, what are those numbers meant? Those are EGFR, your glomerular filtration rate, how much the kidney is still functioning. Usually is about 50 to 60%, you have no complaint at all. Even if you are only 40% working, functioning cells in the kidney, you can still be as happy as ever. Normally it start to show up when you're below 30. All right, but that is also not uncommon to see people having 28, 27, still laughing about going to the office. But once you touch 15 and below, you are bound to have some form of problem. That is usually too late. Oh, by the way, when you go for dialysis, even if you're not worried about it, your life will be completely changed. Tell me, how many hours do you go, or how many times you go per week to the dialysis center? Any of you know? I'm sure some of you have friends or family members, or even if you yourself, can you help the rest now to give your experience? How many times do you go? And those of you haven't got any dialysis and not told by any doctors yet, please check your medical report first. Go and take your blood test, check your creatinine, check your EGFR, and check your urine test so that there's no albumin, there's no blood cell in the kidney. These are the 3-4 things that it is a must. Of course, you must check your hemoglobin too, because those kidney failure cases will normally also have anemia. Anyway, let's go. I asked you how many times you have to go for dialysis per week. Now you have to be prepared, because doctors say you have got no choice. Yes, 3 times per week. Each time how many cases? How many hours? 4 hours. So you have to spend time 4 hours in the dialysis center, not combining with the traffic jam and the transport. And usually you're too weak to drive yourself, and your family members don't want you to go alone. So it takes up another family members, and therefore a lot of life, what you call style, have to be changed. And remember, you cannot travel as usual anymore. You have to do pre-booking before you go to any country. Sometimes you are worried whether your so-called fistula, you remember AV fistula? For those of you who have seen, those who are going for dialysis, they have to have this AV fistula ready-made. Okay, and why? Because the vein is not big enough for you to pierce through the needle for the inlet and outlet of the so-called needle that has to be placed to be connected to the dialysis machine. And this machine will process for you, and therefore you'll be going in and out almost for 4 hours. And sometimes you have nausea, sometimes you even vomit, you have headache. Of course, you feel very tired for a couple of hours. By the time you're ready, it's going to be a next dialysis session again. So life will never be the same again. So I wish all of you haven't got any form of kidney problem or still struggling, please listen before you have to go for dialysis. Okay? All right. Can you imagine if you can analyze your kidney, or make it as an analogy. Analyze means what? Analyze means check your report, check your statistic, whether it's going up or down within 1 year. Those who are having a real problem, you have to do it every 3 months. Those who are normal, and if you're above 50, please do it once every 6 months. Right? Do the full blood test and make sure, like I say, you must know your kidney function test. Okay, let's go. So I want you to have an analogy like two kidneys that God have created for us, just like our assistant in the house. You know, you have what they call house assistant, and this assistant normally they will clean up for you, and they will mop the floor, they will clean up everything, and the point is they will work for 24 hours non-stop. They even never ask for a holiday, never ask for a rest. Even dialysis, you remember, it's only 3 times per week and only 4 hours each time. That's only 12 hours. But the assistant in the house that support you and clean up the house, the mess, they will work for almost 24 hours. Yeah, they will work 24 hours per day, times 7 is 168. 168 hours per week, non-stop ever since you were born until now. And we didn't even say thank you sometimes. We forgot, right? You know, we forgot to be grateful to what we have. So what we do, we just whack, we just put more sugar, we just put more pressure in the form of any one of you who have diabetes and high blood pressure. Before your kidney fail, can you please focus on correcting? Whether you like it or not, you have to reverse your diabetes, your blood pressure, your cholesterol, your obesity. And if you haven't got one, don't spike up your blood sugar easily, because that's the number one cause of kidney failure, spiking sugar before you get even type 2 diabetes mellitus. Why? Because each time you spike, the sugar will search for some form of protein which you also add like crazy, especially the processed protein. I'm not saying protein is bad, but when you're well, you start taking all the processed food, the sugar will attack or rather combine with the protein and become glycated. That's what we call advanced glycated end product. Never mind the name. There's a term where it becomes so sluggish that it will block, will become like a traffic jam in the glomerulus in your kidney. And look at the assistant that you have just now. These two assistants, sometimes they became too tired. They say, please give me a break. But they have to continue working. You know, it's not like a human being. When they ask for a break, if you don't give it to them, they will just run away. But our kidney, the assistant will always be there until they completely give up. All right? And you know very well, even if 50% is working, you still feel good. And that's why kidney is always among the most difficult silent killer for us to detect until we are very sharp in doing our own examination vis-a-vis the blood test, you know, and your signs and symptoms which may not be showing up at all during early stages. Okay, let's go. What are the causes of kidney failure? One of the most famous one is obesity. You heard about it? When you're obese, there's a lot more work for the kidney. When your uric acid is high, for people like me who have gout, and therefore you will have number 3, the most top 3 cause of kidney failure is painkillers. How many of you are on painkillers? You know, painkiller like Simplex, Voltaren, even ordinary Panadol and all that. Be very, very careful. Because painkiller are the most well-known synthetic drugs that can slow down blood flow in the kidney. Anything that slows down or compress the glomerulus, the filter system in the kidney, will make it dysfunctional eventually. It become very stiff, it become very breakable, and sometimes when it's not working anymore, it'll tend to leak. Once it leaks, that's how your albumin can be found in the urine. That's why your blood can be found in urine. And that's why your urine become very foamy. You heard about all this? Okay. So fatty liver is another reason, but that's something for you to consider, because I've talked a lot about fatty liver, including young people. And the moment you enter dialysis, our topic for today is when you hear the word dialysis, your dialysis does not start at the day or on the day that you enter the dialysis center. Dialysis starts 10, 20 years ago while you are not preparing for you to go to dialysis. It's already been preparing to just become lazy, die off, and sometimes they are crying down there, but you don't give a damn until you accidentally found. Most of the people who saw their EGFR is accidental because not all blood tests or lab tests will include your EGFR. So you have to request very strongly from now on. Okay, let's go. So what do you do? Okay, to ensure that you don't go into dialysis. The answer is number one, correct your diabetes. Make sure you don't spike your sugar easily. In other words, you don't eat unnecessarily, and you choose the one that does not have high sugar at all. If possible, no sugar at all, including fruit juices. I'm one who proposed all of us should take fruits, rainbow fruits, veggie and all that. But the moment you make into a juice, especially sweet fruits, that is already considered spiking your sugar. Anyway, if you have stage 3, stage 4, be careful of avocado and even banana. Why? The potassium might be very high already in your so-called dysfunctional kidney, and now you're adding more. Even though pisang or what they call banana is very good, and avocado is very good, but the potassium, the extra potassium there may cause more problem. Let's go. Water intake must be sufficient, just nice, never under. But when you are practicing in the gym or when you are doing hard work, any intensive gardening and all that, and you're sweating, please drink more than usual. Why? Dehydration plus plenty of painkiller in your body is the number 3 cause of kidney failure. Number 1, diabetes. Number 2, blood pressure. Number 3, painkiller with dehydration. Number 4, high uric acid. Number 5, the rest. Okay, especially food that contain a lot of toxicity, a lot of things like heavy metals and chemicals. You know, nowadays a lot of preservative colorings. Those are the one. Okay, let's go to vegetables. Fibers are very good. You continue with it, and anything that's good against cancer will also be good against kidney failure too. Most of the good thing about taking raw whole food, they are quite good for most of the diseases, except for, like I say, when it's too late, you have to be careful of your potassium level. Therefore, certain fruits, especially, I said just now, like what? Like avocado and banana. But if you take more apple, berries, guava, and the other one is papaya, those are very good, okay? And you can take fish, good fish, yeah? But nowadays, if you're not careful about fish, some places, the water, the sea are full of what you call radioactive substances, heavy metal. So what you do is you take from fruits, the omega-3 like sacha inchi. You know, that's why I developed the sacha inchi, what I call supplement, because I know it's not easy to get omega-3 from fish nowadays. Anyway, the fruits and the veggie that is so plentiful in Asia, you can have it. Okay, if you're not sure, you spare with supplement called moringa, because moringa has been known to be a best superfood in the world. Okay, and next, don't forget your sunlight. If not, you take vitamin or this combination of vitamin D3, K2. So all this thing is not developed just for people, it's for me. And that's why I used to take a lot of painkiller. I got so scared, but I don't have any idea then. But 8 years ago, since I was having severe gout attack, and there was once I was hospitalized even, I went to take out my tophi, my body became septic, blah, blah, blah. I became panic. Then I searched for an answer. Lately, there's one supplement I developed called Suppress Pro, made from herbs, worked together with university professors, and also some of the research work we did to make sure that it's very safe and it's not will be worsened. You know, your kidney is so sensitive by now. When you are only GFR 44, you get very panic. I did have that experience last year actually. So this year I'm at the level of 66. I wish to touch 70. And then what do? I improve my clotho because in the kidney the clotho will go down. It's a protein actually, and it's very well known to go down, especially when you're aging, because clotho is also anti-aging. In fact, in Japan and Korea, clotho was developed for aesthetic values, but they did not focus on kidney. Then lately, the scientist has been doing a lot of research. It's still under research, but I can't wait. I'm doing it for myself, and it has helped a lot of my patients and my friends. So I'm recommending it to you. All right. Is a naturopathy, so there's nothing to taste. There's no after effect, but the result start to improve within 2 to 3 months. Can you imagine that? Okay, if you need a bit of coffee without sugar, no problem. Coffee is known to help the kidney too. A little, 2 or 3 cups maximum. And then all the trans fat, seed oil removed, no sugar, no milk, no processed food, and make sure your protein are organic. If you are having kidney problem, please don't joke with protein, right? Because protein is good, but once you're on dialysis, even protein have to be controlled. So be very careful. Take a lot of olive oil, coconut oil, and sacha inchi oil. That's very, very good. Good enough. What else? Steroid. Be careful. If you're taking any form of steroid, try to cut off. All right. This normally are given to people like me who had chemotherapy before. So the steroid can cause a lot of side effect after post chemotherapy. Be very, very careful with it. All right. Try to improve and make sure you do a lot of sun exposure. That's all. If you go back to healthy lifestyle and make sure food, and the key is sugar, blood pressure, painkillers. These are the three most uh, real enemy towards your kidney. All right. Thank you very much. Hopefully, I have learned something tonight. So, and hopefully, you are not going. You can cancel your dialysis appointment. Thank you very much. Take care. All the best.